a doctor or a moon shuttle conductor?
Bald-faced lying, calculated deceit. I don't have much experience with that sort of thing.
Transfer complete.
Greetings, this is Lieutenant German Galven speaking to you from some random subspace channel. Today we'll be talking to a couple Starfleet medical officers who have made quite a name for themselves. Without too much to waste, here is the Ask a Doctor podcast. The first question is,
what is your best medical advice for preventing officers, namely red shirts, from continuing to injure themselves?
Dr. Solok says, the most successful means of avoiding injury is to minimize risk as far as possible when engaging in the fulfillment of one's duties. Officers who seek altogether too frequently to outperform their colleagues or even their own past performances by interpreting their responsibilities in creative or self-serving ways often find themselves ending the mission in sickbay. Of course, those officers who find themselves injured repeatedly perhaps consider opportunities for service elsewhere than aboard a starship.
I would tell them to think before they act. 9 out of 10 injuries that I see in the Gorkon's sickbay are all caused by a lack of forethought, or by jumping into the fray with too much brashness and aplomb. Firing a phaser without proper preparation can cause unnecessary injury.
What's something about the job that neither medical school nor the academy prepared you for?
Well, that sometimes people don't want to be helped. During my first mission aboard the Gorgon, on a ship to Sakuna, we had an encounter that resulted in the brutal beating of someone who shouted abuse at me. We were there to provide supplies, and this woman, was a part of a group of Romulans who felt they did not need our help, did not need Starfleet's help. I was shocked by the pride and the stubborn gall that the people had, even to their own detriment.
Dr. Solak says, neither medical school nor the Starfleet Academy were sufficient preparation for the sheer variety of personalities with which one must deal with as a medical officer aboard a Starfleet vessel. Medical progress can, in fact, be hampered by the efforts individual patients and some physicians make to imbue the practice of medicine with humanizing elements. Medicine need not to be humanitized. It is more than satisfactory pursued by non-humans. This Denobulan is trying to sound Vulcan.
What makes a good doctor, and what makes a great Starfleet doctor?
The great physicians historically are those who have made the greatest breakthroughs in the understanding and treatment of injury and disease. This requires both intelligence and discipline, as well as diligence and an openness to the anticipated. Great Starfleet doctors possess all or most of these traits, in addition to rigorous commitment to the benefits of exploration of previously unknown worlds and peoples. As one might expect, there are very few such individuals.
A great doctor is someone for whom medicine and healing come as instinctive responses to harm. And a great Starfleet doctor is one who can improvise under pressure and utilize any and everything at hand to carry out their sacred duty.
Oh, I need a break. I'm feeling super anxious. What can help me? Oh, look, an ad about a medical breakthrough. Let's hear it.
Feeling the burn from a solar flare? Warp core breach give you a tan inside and out? Do people smell something burning whenever you're around? Try new Hyranolan Platinum, now available wherever fine hyposprays are dispensed. You'll be back on your feet and ready to fix that coolant leak in no time. Warning, Hyranolan Platinum has been known to cause dizziness, headaches, constipation, space madness, excessive sweating, diarrhea, temporal anomalies, subspace blisters, and mild flatulence in Tellarites. If symptoms last longer than 4 hours, please consult a physician. Not for use by those pregnant, nursing, or hosting a symbiotic organism. Ask your doctor or emergency medical hologram for Hyranolan Platinum today.
I feel calmer already. And now, back to the podcast. If there was one thing you'd change about Starfleet as it pertains to your work as a doctor, what would that be? Starfleet provides physicians such as myself with adequate resources to practice medicine well, in addition to the authority required aboard the starship to do so. If there were one change I might suggest, however, it would be to eliminate an assessment of the so-called bedside manner from the performance evaluations of our physicians. How well a given physician interacts with their patients on an interpersonal level does not seem a relevant factor in determining their adequacy as a medical professional.
Naturally. I would make sickbay a little roomier and larger on every single ship in the fleet. Too often, too many biobeds are crammed into spaces far too small for the quantity. I would also request better in-field medical training for all Starfleet officers, regardless of where they are posted, or what they do. Too frequently, I have patients who have been healed inexpertly in the field and require extra care and sickbay. If I had my way, my job would be no longer necessary, as everybody would be doctors.
And this has been the Ask a Doctor podcast. Please subscribe to our channel. And thank you. This was Lieutenant Commander German Galven, signing off.
Very impressive.